Handicap International traces its origins to the camps of Cambodian refugees who'd fled to Thailand. It was founded in the early 1980s to address the needs of the thousands of people who had been mutilated by mines and people with disabilities for whom international aid was poorly adapted. The association opened its first orthopedic and rehabilitation centres with simple and concrete solutions, adapted to the context that drew as far as possible on the skills existing in the community and the available local resources. This philosophy inspired Handicap International, whose programs have since extended to other countries in Asia, Africa, Europe and Latin America. In a quarter of a century, Handicap International has become an international organization structured as a federation drawing on a network of national associations. Many thousands of team members, both local and expatriate staff, run more than 300 projects in around 60 countries. Handicap International's scope of action has gradually increased to take into account different types of impairments and disabilities, physical, sensory or mental. But also it extends beyond people with disabilities to other categories of people or populations that are vulnerable, marginalized or particularly exposed to risks. Today, Handicap International works in the following contexts: in emergencies and situations of conflict or disaster, post-crises. In the context of development, Handicap International works also in situations of chronic instability that impact on the living conditions of people in many countries. To address the needs of the various categories of beneficiary groups, including people with disabilities, vulnerable groups and populations exposed to risk or affected by the crises, Handicap International mobilizes skills and draws on its recognized expertise in various sectors of activity. Handicap International works to prevent impairment and disability linked to diseases, accidents and violence, to ensure the service offered in our sectors of activity is available, adapted and accessible, to strengthen capacities to promote social participation and the application and exercising of our target beneficiaries' rights. But the history, experience and expertise of Handicap International are also that of crisis situations. In conflict zones where various kinds of weapons, mines and munitions have been employed, where persons and communities are exposed to the danger of weapons and explosive remnants of war, demining, depollution and risk education campaigns are undertaken. To provide assistance to populations forced to flee due to a conflict, violence or serious violations or because of natural or man-made disasters, Handicap International coordinates and manages camps for refugees, displaced persons or people living in disaster areas, in addition to providing for these populations' basic needs. Among these populations, our action is particularly focused on people with disabilities. After the acute phase, Handicap International undertakes reconstruction activities. We also run risk reduction and disaster preparedness projects in particularly sensitive areas. During conflicts and disasters, or in their immediate wake, to organize relief, to provide adapted assistance and cover basic needs, with a special focus on people who are particularly vulnerable and those with injuries or disabilities. Our comprehensive approach takes into account the various factors that cause situations of vulnerability and disability. The aim of our actions is to reduce risk factors, strengthen the capacities of our beneficiaries, adapt the physical and social environment, and improve the services available and their accessibility. Our activities can require different levels of intervention and take different forms. Supporting people and communities to help them access the services they need, support for services, national systems and professionals in order to improve the range and quality of services offered to populations. Contribution to the improvement of national and international policies to encourage a better response to needs and the application of fundamental rights. Handicap International also works in the advocacy field through testimonies, mobilization of public opinion, and dialogue with authorities. It seeks to improve national and international public policies, promote and improve the legal frameworks and conventions relating to human rights, international humanitarian law, and disarmament. Thus, Handicap International was involved in the process that led to the creation of the Ottawa Treaty banning anti-personnel mines, the Oslo Convention banning cluster munitions, and the International Convention for the Rights of Persons with Disabilities. Handicap International's work has received many international awards. In addition to its special consultative status with the Economic and Social Council of the United Nations, Handicap International has also been awarded in 1992 the Testimony Distinction of the UN Secretary-General in recognition of its contribution to the United Nations Programme in favour of people with disabilities. In 1996 the Nansen Prize and Medal from the UN High Commissioner for Refugees. In 1997, as co-recipient of the Nobel Peace Prize, Handicap International saw its work to ban anti-personnel mines recognized and rewarded. The Conrad Hilton Humanitarian Prize, awarded annually to humanitarian associations for their exceptional contribution to alleviating human suffering, has been presented in 2011 to Handicap International for its work in assisting people with disabilities in situations of poverty, exclusion, conflict, and disaster.